Hello, my name is Haley Fleming, and I work as the Health and Safety Supervisor here at Holistic Medical Corporations, which is a Canada-wide company with its main headquarters in Toronto, Ontario, and Vancouver, British Columbia. Here at Holistic Medical Corp, we employ approximately 1.2 million healthcare professionals from all across Canada. Our employees work in hospitals, acute care settings, long-term care facilities, and clinics. In all these settings, the most important aspect of any healthcare professional's job is the health and safety of not only yourself, but your patients. Having proper health and safety means protecting yourself and others from being injured or getting an illness while on the job. This is extremely important as many healthcare professionals do unfortunately get injured or become ill from the workplace, which can all hopefully be prevented. There are a few things we can do in order to create a healthier and safer work environment, which I'll be explaining next. Some of these things include making sure workers know about hazards and dangers by providing information, instruction, and supervision on how to work safely, making sure supervisors know what is required to protect workers' health and safety on the job, creating a workplace health and safety policy and procedure act, making sure everyone follows this act and laws and the workplace health and safety policies and procedures, making sure workers wear and use the right protective equipment, doing everything reasonable in the circumstances to protect workers from being hurt or getting a work-related illness. Every single healthcare setting has certain protocols that you have to follow in order to maintain health and safety in the workplace. This can include WHMIS, which is the Workplace Hazardous Materials Information System, and other protocols that will help tell you what to do in all different types of health and safety situations. One major health and safety issue in healthcare settings would be the use of sharp objects, specifically needles. Needle stick injuries are extremely common but can be prevented when following proper disposal protocol of sharps in the proper containers. Bacteria is a huge health and safety concern in healthcare settings. Workers remaining healthy and safe at work is extremely important. In the 18-year period from 1993 to 2010, 16,143 people lost their lives due to work-related causes. This is an average of 897 Canadian deaths per year. These numbers are staggering and very unnecessary had the proper health and safety protocol been enforced. Some recommendations for enhancing the health and safety in the healthcare workplace would include how you take care of yourself and others regarding hygiene and renewing information, and then further reinforcing the information with testing. Hygiene is extremely important in the healthcare setting as bacteria grows on every surface. Not only do you have to wash your hands frequently and efficiently, but it is important that patients maintain their hygiene as well. The better the hygiene, the less bacteria that can be transported into their mouth / to open wounds, which will ultimately affect their well-being. You as a healthcare worker must keep hygiene extremely important in your life, as we are regularly touching our clients and the possible transmission of bacteria is present. Renewing the protocols and information of health and safety is extremely important, and reinforcing this information by testing yourself is important so that you retain the information. A safety and health management system, also known as an injury and illness prevention program, is a proactive, collaborative process to find and fix workplace hazards before employees are injured or become ill. Almost all successful systems include 6 core elements: management leadership, employee participation, hazard identification and assessment, hazard prevention and control, education and training, program evaluation and improvement. Many hospitals already have these elements in place to comply with Joint Commission requirements for patient safety, and some have adopted a related set of high reliability organization concepts. It is a natural fit to extend the same principles to employee safety. Safe patient handling. Your hospital can address the biggest cause of workplace injuries with a comprehensive program to promote safe lifting, repositioning, and transfer of patients. Safe handling programs can include equipment, which can range from ceiling-mounted lifts to simple slide sheets that facilitate lateral transfer, minimal lift policies and patient assessment tools, and training for all caregivers or for dedicated lifting teams on proper use of the equipment. Several provinces require hospitals to implement safe patient handling programs, and more are considering it. Many tools, resources, and best practices are available to help you build or enhance your program. Certain concerns for health and safety include the transmission of bacteria, as previously mentioned, or failing to follow protocol resulting in a negative or harmful health and safety situation. One other major concern for health and safety is the failure to remember certain protocols or important information regarding your safety as well as your patients. In this era of superbugs, there is an increasing attention paid to the fact that healthcare workers are continually exposed to infectious airborne diseases. But what most people don't realize is that toxic chemicals found in various cleaning supplies, as well as other pathological and diagnostic materials and treatments, are also putting workers at risk. Reducing the use of harmful chemicals and putting a system in place on how to safely handle them can help reduce this risk. This first chart shows the number of people per year per 100 full-time employees that have an injury or illness at work in a hospital. These numbers are much higher than the US average. This next chart shows that hospitals are the number one job field with the most health and safety injuries, coming in at an average of 157.5 cases per 10,000 full-time employees per year. This last graph shows the top 5 causes of injury among hospital workers, which includes overexertion, slips, trips, and falls, contact with objects such as needle stick injuries previously mentioned, violence, exposure to substances, and other causes. In conclusion, it is important to remember that renewing health and safety protocol at work is extremely important in knowing how to deal with health and safety regulations and situations. Proper hygiene is crucial in the maintenance of good health and for stopping the transmission of harmful bacteria, because the health of you and your patients come first. Lastly, don't expose you or your patient to a dangerous situation by keeping the workplace as healthy and as safe as possible.